I have to thank the organizers, Dr. Ravi Shankar as well, and others who have made me possible to stand here in front of the august audience. It's, it's a coincidence. I don't say coincidence. I will say it's a miracle that I'm here. So even I don't know why I'm still here or whether this topic is that important. It was just in the end of November that I visited Kashi, and I've just told the same story to others as well, that after going home, after visiting Kashi, I just went home in the first week of December. I just came back from the hospital at around 7 o'clock, and I was sitting, and my wife was sitting just next to me. And we were watching TV, and I just told my wife, probably I want to visit Ayodhya. I just told her, and the very next second, I got a call from Dr. Ravi Shankar saying that, would you be able to come to Ayodhya? So it was just ethereal feeling. When I told my wife that I got a call for an invitation to Ayodhya, so even she was shocked and surprised actually. So that was the miracle that happened. But still I'm not convinced that why would, say, Lord Rama or Radha Ram would ask me to be here. But probably it is to learn a lot from you all, especially the speakers, and probably to gain more experience. I may not be not that knowledgeable, but probably what I know is in psychiatry aspects of it. Right? So let me start with that brief, small introduction, and let me continue with my talk. Now, I would like to dedicate the whole talk to him as well, because he was the one who is responsible for this miracle. Now, this mantra, like Sri Rama Rameti Rame Rame Manorame Sahasranama Tattulyam Ramanama Varane, it's often recited at the end of the Vishnu Sahasranamam, and it was actually Bhagavan Shiva who said to Ma Parvati when she asked, whom do you meditate on when the whole world meditates upon you, or the whole creation meditates upon you? He says Rama. So then he says, why? So then he says, uttering Rama's name once is equal to uttering it 1,000 times. So that's what it is. And we know this city of Ayodhya, there are so many Ram Bhakts here. So I just felt that at least seeing one of them would, make my life blessed. So that's what I just came here for that. And we know the Ram Bhakts of Hanumanji, Ramdas and Tulsidas. We know how much they are. And I wrote a small line in my friends group that even if I have one atom of bhakti of what Hanumanji has, I think my life, this whole life has been served enough. And I would like to dedicate it to the Ram Bhakts of Ayodhya who have been fighting for the last 500 years and who have lost so many lives. Right? I dedicate this talk to them as well. And yes, we are here. Now, why would I want to talk about, this is something called as Taraka Mantra. Tara means, it's not star. Tara means to cross over. Right, from one life to another. So that's what, or crossing over to merge with the Parabrahman. So that is what is Taraka Mantra. And there are 3 Taraka Mantras that are given or noted in our scriptures. Om Namah Shivaya is one, Om Namo Narayana is one, and Sri Rama Jai Jai Rama is one. So what is these mantras, or what are these indicators? Crossing from the what is living to the dead, or to merge with the Parabrahman. When I was small, my mother used to celebrate a small local festival, right? And it was called Polamasvargam. So I was just curious. So, and Polamasvargam, what is Polamasvargam? She was a daughter-in-law has mother-in-law issues. In some scriptures, olden days, the story was being told. And finally, she goes to heaven, or she goes to Vaikuntham. And then the picture is that Pushpaka Vimanam comes to the ground, and then she goes. So that is the story of that thing. So I was reading about past life, I was reading about near-death experiences. So coming to my topic. So what is near-death experiences? So near-death experience is a conscious experience in which the individual experiences a sense of being detached from the physical world during the process of physiological dying. So I'm trying to give what is called a scientific as well as from a psychiatric perspective kind of a picture, and as much as possible from the evidence base which is there in the literature. I may not be as forceful or loud as my previous speakers, so kindly forgive me for that. I know they are, I was just surprised about the amount of energy and motivation they had. So I can't match that, so probably may be disappointed with that. But yes, so this is what near-death experience is. So in my experience, I mean, I have seen a couple of patients who survived cardiac arrest, right, who survived cardiac arrest after being revived, and they had so what is called, it's not called trauma, but post-trauma experiences, which they had, say, anxiety issues or other experiences, so which I had to address. So that's where the experience comes in. Now, there are these near-death experiences are individualistic. So what does individualistic means? Every person has different experiences coming from their educational background, coming from their social background, cultural background, religious background. So they have what their mind is made up of, what their thoughts are made up of, or what their bank is in their thoughts. So those experiences that come out at the time of death. So that what is the time of death? Near death is roughly around 5 minutes, 10 minutes, or say whatever, how much of a short time they have. So that is what happens during that time. So what is a near death experience? So there are people who keep telling that what do people experience is, one thing is being dead, the second is in the peace and a state of painlessness. So that's what they keep experiencing during those 5-10 minutes. And there's a sense of separation from the physical body, right? And many of them do say, I'll go back to the previous picture, that they experience as if going into a tunnel and then experiencing a bright light and then coming back from that. And in our culture, there are experiences of people who say that we have been taken by two Yamaduts who are dark in color, and we have gone to a place which is dark again, and there is Yamaraj is there. I mean, they do tell, I mean, there was an Indian study which showed that they do tell this story, because this is from the cultural background which we have been exposed to. And then finally someone writes that, okay, we brought you here by mistake, so you need to go back. So then that story that they come back and then they are awake. So, or they are conscious again and they start to live again. So that is what is the experience of the people from Indian background, cultural background. And then there are people who say that, or most of them, even people who are from Indian or cultural background, they say that they have out-of-body experience. It's called OBE. So what is that out-of-body experiences? As if they are, say, what is called seeing themselves from above the ground and seeing what is happening around the ground. So that is what is depersonalization kind of an experience we say in psychiatry. So a sense of an encounter with recognizable ethereal entities such as family, friends, angels or religious personages. These spirits may appear to be enveloped in light. There is a sense of rising rapidly into the heavens. The sense of encounter with a being of light which emanates unconditional love and experience of panoramic total life review, and a sense of self-judgment about one's life while bathed in unconditional love of being the light. A sense of reluctance to return to this world. There are two experiences, not just one experience. One is they don't want to return because the experience is very pleasant, or sometimes when they think that they're being punished or something mistake is being occurring there, they feel that, they don't want to return. So that is also there. A sense of a compression or absence of time and sensing no restrictions of space but a freedom to go where the experiencer chooses. Now, there are some theories as to what other experiences people can have according to Western literature by Noyes and Slyman. There are three types. Mystical, the sense of harmony and unity, color or visions, and a feeling of great understanding. Two is being depersonalized, like I was just mentioned, loss of emotion detached from the physical body and an altered sense of passage of time, and being hyper alert as well. Experiences sense that his or her thoughts are sharply defined, vivid and accelerated. So what it means is, there are experiences where people feel that their senses are they experience what is called increased senses or increased perception. So they see more clear, wider vision, their sense of smell increases, their sense of hearing increases, they tend to hear voices from which are very far distant outside the sensory locations or geographical boundaries. So this is what they keep experiencing and they keep telling. Now, what are the various psychiatric aspects of near-death experiences? So, there are various aspects. Are there cognitive aspects? There's an emotional aspect is there. So like that, there are various aspects of psychiatry, and the first one we say is the altered sense of time. I don't know whether we do experience, suppose most likely early in the morning when someone wants to wake you up, they ring a bell, right? Or they ring a bell, or there's an alarm which switches on when you want to wake up automatically. And then sometimes a dream starts. So a dream starts saying that, okay, I'm going out, I'm driving somewhere, I'm going to a mall, I'm doing the shopping, or I'm watching a movie or something, then I'm meeting people around, going to a function, and then coming back late in the night. And then when I'm just entering my lane, I press the horn or something like that, right? So and suddenly I wake up at that time and realize that there's an alarm bell going on, or someone is ringing the doorbell. So early in the morning or around that time, and then I realize I wake up, and then I open the door, and then really someone is there. But actually this elaborate dream has started from the very first second the bell has started. So what it means is, actually the bell has rung only 2 seconds or 3 seconds, or the alarm is there for only 2 seconds or 3 seconds, but within those 2 or 3 seconds, you had this elaborate dream of around 10 to 12 hours. Right, so that is what is expansion of time in dream, wherein in reality is only 2-3 seconds. So this is what exactly happens in one of the experiences of near-death experience as well. That is what is called as altered sense of time. And there is accelerated thought processes. So the multiple thoughts, initially we think that our brain has a capacity for a couple of thoughts, but then during that time you will have what is called as concerns about various thoughts, and you'll be as if you are multitasking at that time, and you will feel super powerful that you are able to think about so many things and resolving so many issues at a time. So that is what is one of the thoughts, and there is something called as life review as well. So what is that life review? Life review is, just to give you an example, suppose, suppose if I tell you now, or when you are at home, for example, when you are at home, within 5 minutes, you have to vacate the whole house, and there's a vehicle standing outside, you have to what is called as pack everything, whatever in those 5 minutes only, and then go off. So what will you do? So the main thing is, you will take whatever is important, probably your certificates, in those 5 seconds. Right? That is what is called flashback, or what is called, whenever people are dying or falling down a cliff or something, they see that my whole life came back to me within those seconds. So this is what exactly, when not the whole life, but most important events that have occurred during your life, that has come back. So that's what you remember. So that is what is life review. And sudden understanding, and everything becomes clear. Like I've mentioned about, because you become multitasking, you think that now suddenly every problem you think you have got the solution, and everything becomes very clear, and you have become magnanimous, you have become altruistic, and then you got the understanding of many things that were problematic when you were alive. So that's what is one of the experience cognitions. So that's how the perception is there during that time. And then the mood elements. Suddenly you will feel that no anxiety, so no tension, no fear. Suddenly you feel that everything is peaceful, everything is relaxed, surrounded by a soothing, pleasant, bright light. There's a feeling sometimes of ecstasy and joy, that kind of ecstasy, that happiness that you have never felt in your life. So that kind of emotions that you have at the time that near-death experiences are there. and then the feeling of oneness with the cosmic unity. So as if you are not separate at all, and that you are completely one and everyone is one. So that kind of altruistic feeling is there when the emotional aspect of psychiatry. Now there is dissociative or what is called paranormal elements. So what is dissociative and paranormal elements is, like I've said, mentioned, out of body experience, as if you're looking yourself from above, or you're looking the whole world from above and you're looking all your relatives from above. So that is the kind of feeling that, I mean, you see your own body there, but then you are outside your body. So that is what is called out of body experience. And then extrasensory perception. So that's what which I mentioned. What you tend to hear things, or you tend to smell things, or you tend to have some taste, or those extra, I mean, the sensory systems which are there, which are beyond the boundaries that that's what you experience. And then the senses are more sharp and more vivid than before. And then sometimes some people get visions of their future as well. And then the transcendental elements. So we may call it hallucinations at that time, or sometimes delusions, but this is what experience that people do have. That is the out of the world experience they have. And then they have, as if they are encountering, they are seeing some live beings, but non-earth. They are not beings from the earth, but then they are accompanied by those beings, they are surrounded by those beings, like mystical beings and all. So, but these beings are what is called influenced by the cultural background or the religious background which they have been taught since childhood and other. And they are traveling very far, fast, and feeling of not returning. So these are the few what is called elements that are present in out of what is called near-death experience in people. And these are few case experiences of, say, Western societies where the case series are there. When there are several studies, more than, say, around 3,000 people who had near-death experience. They have been studied in total, but in various studies starting from 1951, 1976, 1980 and 2014. The last one was 2014 case series. So all these are case series which have more than 200 to 300 patients which they have examined, and they have done several studies, and most common themes were something like this. Say on the 4th day following that operation, that's in the patient's own terms, I went into a shock and became unconscious for several hours. Although thought to be unconscious, I remembered for years afterwards the entire detailed conversation that passed between the surgeon and the anesthetist present. I was lying above my own body, totally pain-free, and looking down at myself with compassion for the agony I could see on the face. I was floating peacefully. Then I was going elsewhere, floating towards a dark but not frightening curtain-like area. But I felt total peace. Suddenly it all changed. I slammed back into my body and was very much aware of the agony and pain again. So this is what the experience in the patient's own words. So like that we have other examples and other cases. The Indian studies and experiences. Culture shapes, like I mentioned, the near-death experiences, which in turn contribute to shaping of the culture in more than 30 Indian cases. But which was one of the studies done at Nimhans as well by Dr. Paraschar. Instead of light beings, Yamdut took them to the Yamaraj with a book. He discovers a mistake in the book and the individual is asked to return to the terrestrial life. Post near-death experience marks are found in some Indian cases, like branded on their body in other realm, and these residual marks resulted from the subjects being forcibly pushed down. So these were some of the anecdotal cases which were studied in Indian context. And even children, do have what is called near-death experience, and they are much more reliable as well, because they don't know, not manipulation, but they are more frank and more open, and exactly in their own words they describe what they have felt. So there's nothing, and they haven't learned what is called, their experience in the past is very little. So we can genuinely believe what they have said. Now, in a study, 35 children who have experienced near-death experience, they describe precocious wisdom and certainty about life after death. Frightening childhood near-death experiences are rare in the literature, but few have been reported. Such experiences lead to nightmares, restlessness, and prolonged anxiety among the children. These distressing experiences begin or end with a positive note. So that's what in children. And then, from psychiatric point of view, how do we describe this neurobiology or of what's called near-death experience? So when, it's very hard to what is called as study the neurobiology of near-death experience. So we don't know whether the patient is dying in front of us. We don't know whether the patient will be revived. So we don't know what, we know that EEG or CT scan or MRI scan, but we can't do it that exactly the 5 seconds before the person is dying. So it's very difficult to neurobiologically prove anything what we are trying to do. But there are few studies, there was case studies, which I say anecdotal case studies, what could have possibly happened in those patients. When you talk about because they have some hallucinations, so we know hallucinations are because of certain chemicals in the brain. So 5-dimethyltryptamine is one, and NMDA is one, and then serotonin molecules. So these are certain molecules which are responsible for, triggering hallucinatory behavior in patients. And then the depersonalization is one of the experiences of temporal parietal lobe lesions. So sometimes in fits or epilepsy, which we say, people do experience depersonalization, and they are localized in certain areas. Now again, review of life events. So when we say review of life events, they are memory concepts. So memory is more likely situated in hippocampus, and then the emotional kind of a memory, again hippocampal to amygdala, what connections are there, or what is called conscious, or not conscious, but more cognitive memory is present in the prefrontal lobe cortex to the what is called as the hippocampal connections. So these life review, probably these are the areas that are more likely to be involved. And when we talk about serenity, ecstasy and oneness, again the emotional area, which is very more calm, relaxed, all-compassing, altruistic kind of a behavior. So we are trying them to localize in amygdala, nucleus accumbens, and again the prefrontal complex and cortex. And then the tunnel vision. So when we say that they see a tunnel, probably because of the blood supply, reduced blood supply before death in the eye, or reduced oxygenation in the retinal vessels and all. So probably they have a tunnel vision. They try to describe that in their what is called near-death experiences. So couple of studies, there was one case study which was performed, probably they were, I don't say lucky or, but they were studying, the patient had recurrent seizures, so he was put on an EEG machine to study the seizures continuously, because it was resist of the patients who have been revived, right, after being, what is called dead, probably they have near-death experiences. And in one study, so it was 2014, it was done an exhaustive study of 344 patients who suffered cardiac arrest and were revived. Around 10 to 12% of those patients had what is called as near-death experience. Not everyone will have this near-death experience. Right. And according to Talbot 91, near-death experience appears to have no relationship to patient's age, sex, marital status, race, religion, or spiritual beliefs, social class, educational level, income, frequency of visits to places of worship, size of home community, or even area of residence. And when we say post near-death experiences, so what are the psychiatric changes that patients, what is called, exhibit when they give out their experiences, or when they tell their experiences to others? So what do they experience? The one thing is, positive experiences they have is that improved cognitions are there. They tend to understand much more better, in a much more clearer way, and they're much more, what is called, understanding of the other person's perspective. Improve understanding from different perspectives. Clarity of speech and language. They tend to speak more slowly, but more firm, using appropriate words. So that's what they tend to do. And mood is more calm and relaxed. They have less fear of death, greater sense of well-being and inner peace, more spiritual, if not religious. greater sense of purpose in life and they are more altruistic. They do have negative impact as well, near-death experience. Not every near-death experience is very pleasant, but some people do have negative impacts on their psychiatric spectrum. And depressive illness, anxiety disorders, post-traumatic stress disorders, psychosis and substance abuse have been reported more in some patients. So I have a couple of patients whom I have seen anxiety group of disorders, one, and then like panic disorders. They have panic disorders when they were confined in a room. So that is something, it's not like agoraphobia, but when they feel that they have a sense of no control about the proceedings. Right. And that's why they tend to have panic attacks, that is having chest pain, palpitations, sweating, as if they're being the sense of dying. So that's what they have. And then one patient had what is called post-traumatic stress. He was very traumatized by the experience of, he died in the hospital, in an ICCU when he was being treated for a heart attack. And then he was traumatized by the experience of being injected with various medicines. When there were several doctors, nursing staff, all that IV lines, and then he was being put on tube, what is called endotracheal tube, to save his life. And yes, eventually after the ventilator he came out and then he was able to talk to us, and that's why he had this experience, post-traumatic stress. But he felt that was not a happy experience. So not exactly all near-death experiences are pleasant. Right. So I had to treat him with medications as well as psychotherapy. So, right. And then they have what is called attitudinal and personality changes that brings about in them as well. There's a heightened sense of appreciation of life, especially of the world, of the nature and of other people. There's an increased sense of understanding of what is important to them and in their life, and strives to live in accordance with his or her understanding of what is meaningful. There's a complete lack of fear of death. There's an attitude of unconditional love and service towards others. And there's a desire to seek more knowledge about death and near-death experiences across the world. And most of them, including Westerners, have found that they find these answers in Hindu scriptures or Indian scriptures. So most of them, so when I said again scriptures, it is, they tend to become more what is called spiritual. So when I talk about there's a spiritual reawakening, universalistic spiritual orientation is a tendency to characterize oneself as spiritual rather than religious per se. A feeling of being inwardly close to God, a de-emphasis of the formal aspects of religious life and worship. There's a conviction that there's a life after death, regardless of religious belief, an openness to the doctrine of reincarnation and gravitating to Hindu scriptures, and a desire for a universal religion embracing all humanity, like the way of life which Sanatana Dharma describes. Now, I just want to put in a brief word about spirituality and science. So, we do get confused between spirituality and religion. And what I can say from my own perspective is that, say, Hinduism or say Sanatana Dharma, what we describe is spirituality only, there is no religion there. Right, to understand it or equate it to a religion, that is a mistranslation or a misperception. So what we define spirituality as from the point of science is inner core or life of consciousness, or a soul or Atma or inner Brahman is present inside every one of us, and there is a feeling of connectedness to all that exists in creation. Right. And every one of us, we feel that there is a purpose of life, and everyone, there's a belief that there's a higher entity or higher consciousness. So these are the various components of spirituality. Right. And the difference or what is commonality between science is the goal. In say what is called science, there is physical or biological science, we have to use that science, and we have to know about science, and then the science is there for us to utilize. Right. But spiritual science is to know and what is called as merge with the ultimate or consciousness or the Parabrahman. And how do they go about doing it? But physics or physical or biological sciences, they use technology and evidence-based to what is called discover what is outside. And so they externalize, try to go outside And spiritual science is a way of life and self-experiential, and that's why they tend to what is called as internalize. So, I did prepare a lot about spirituality as well, from the atom which is being described to the complete universe. And there's a spirituality about connectedness, about the waves which I think our previous speakers have spoken about. And what is the purpose of life, what spirituality describes, is there's one what is called sloka in Isa Upanishad which says that Kurvanniveha karmani jijjiva vichitam samaha evam tvai nanyato tosti na karma lipyate nare. So by performing one's responsibilities in a righteous way, continuously, one should wish to live 100 years in a balanced way. There is no other than this for man to perform their responsibilities in a righteous way, in a non-attached manner. So what it means is, if we have this goal as that our purpose of life is just to live 100 years, continue to do our work till 100 years in the most righteous way, in whatever dharmic way we have. So that purpose is enough. What is before and what is after, we do not think about. So once we tend to live our life in this way, so that should be the goal and purpose of life. So how do we go about it? So when we say, what is the purpose of life? We are born with genes. We are born with 23 sets of chromosomes. And each chromosomes have certain set of genes that we are born with already. So we can't change them, right? So it is like something like this boom box which has more than 200 connections which can be connected. So we have to utilize this boom box, we have to utilize every pore, every socket. So that's what our genes are there. We have to utilize every gene to live our life to the fullest, whatever our genes have dictated us. So whether it is 67 years, whether it is 99.3 years, or whether it is 102 years. So whatever our genes are there, we have to give, it is our responsibility to give our genes their optimal conditions, so that they can perform to their maximum. So that is what is the purpose of life of ours. Right. That should be the purpose of life. So we are born with a life, we have certain genes, there is potential, we need to gain knowledge, skills and practice and gain wisdom to utilize those genes, and we need to live and perform our responsibilities in an optimally balanced way till the maximum. So that's what which our genes describe. And when we talk about the spiritual health, so why I say spirituality is not religion is, spiritual health itself is one of the one of the terms that are described by WHO as their goals, right? The physical health, mental health, social health and spiritual health as well. And spiritual health itself is divided into, say, 5 components: physical health dimension, mental health dimension, social health dimension, religious health dimension and medical dimension. Whatever methods are used, or whatever methods are necessary to prolong our lives or utilization of our genes, right? So we have to use that methods to prolong that. So we have to use either medication, if medication prolongs our life, we have to use that. If spirituality helps us to utilize, so let us use spirituality. Physical health, physical fitness, mental health fitness, social health fitness. So what it means is family, marital life, or friends, or society. If they help us live up to the age of 100 years or maximum, whatever our genes prescribe, so let us utilize that. So that's what it means. So that's what is the goal of spiritual health. Right. So how do we manage the near-death experience from the psychiatrist's point of view is, we listen actively in a non-judgmental way. Right. Let the patient verbalize everything, whatever he wants. So let him first talk whatever he experiences. So it's like a method of what is called ventilation, but we kind of say. And then we try to normalize that experience. We say that yes, many have described it in a similar way. What you're experiencing is kind of normal in what people experience. It's not something very abnormal, and you're not having illness or a disease, or you're not very special, or you don't have, say, what is called, yes. So encourage self-expression. So whatever they try to experience, let them, what is called as, put it out in words, poetry, in the form of essays they can write, in the form of an art they can make. So like that. Provide education and resources about near-death experiences, how people have experienced. There are certain patients are there, okay, I will get in touch with you with that patient if the patient is willing. So you both talk to each other, find support with each other, what kind of, and you want to find resources across the world, we can help you get it, those information. Address, channelize near-death experience toward the sense of purpose of life. They have nearly gone to the death and then come back. So it means that there is some purpose in their life which they feel awakened, or they feel that the life has meaning, understanding. So let them have a sense of purpose of life. And then address any negative symptoms that they have in an appropriate way. Tailor any support, individualized to the patient. And then, if necessary, yes, psychiatric medications are there, and psychotherapies like cognitive behavior therapy wherever indicated. Thank you very much. These are the various references. And I again thank the organizers. I like all the sponsors here and as well, right, to giving